So in terms of the physiological effects then, so before we move to the recommendations, it's important to know what's happening biologically in terms of exercise. So again, this is a figure adapted from Zhu et al., which is an excellent paper, and what we can see is that any type of exercise, be it aerobic training or resistance training, will elicit several effects generally in the body and within the tumour itself. So let's focus first then about what's happening generally in the body. So whenever we do any type of aerobic exercise, we're essentially causing mechanical stress. So as the heart beats, it's causing mechanical stress in the blood vessels, and what that will do, that stress will act on the wall of the blood vessel and it will increase growth factors. So for example, here we have vascular endothelial growth factor, which increases, and some other molecules as well that are important in promoting what we call angiogenesis. Now, angiogenesis is the growth of new blood vessels. When we get more blood vessels growing in our body, it means that we can distribute more of the blood to the different tissues of the body. So they get more oxygen, they get more nutrients, and waste products can be cleared away more easily. So that's one of the positive effects. We also get increased expression of endothelial nitric oxide synthase, which is a gene which causes the release, the production and release of nitric oxide. And nitric oxide causes dilation of these blood vessels that have increased in number. We also get a number of other molecules that increase within the muscle, within the fat tissue as well, in the liver, which contribute to angiogenesis. And the whole idea of aerobic training is that we try to increase the amount of blood vessels within our body, within the different tissues of the body. Now what's important is we need to think about what's happening in the tumour itself as well, and in terms of the effects of exercise in the tumour, the research evidence is quite interesting because it shows quite a lot of positive changes within the tumour. So let's start with the first thing. So when we start exercising, one of the other beneficial effects is that we start to get growth of blood vessels in the tumour itself. Now, so the intratumoral blood perfusion increases. So if you have growth along the tumour of new blood vessels, you're going to get better blood flow. You're going to have reduced risk of having low oxygen levels in the tumour. So you reduce the risk of hypoxia, because if hypoxia occurs in the tumour, then essentially it can release a lot of other chemicals which can start causing damage to the nearby surrounding cells, but also it might contribute to the tumour metastasizing as well. So having better blood perfusion by having a better circulation is quite important, because it means that you have reduced metastasis. And when you have a drug treatment, the drug can actually be delivered to the tumour because it's got its own network of blood vessels. So the intratumoral drug concentration increases as well. That's another effect. We also have an increase in some immune cells which help to reduce the tumour size. So we have natural killer cells which can increase after 6 to 8 weeks of aerobic training, and essentially what they would do is enable a tumour to be smaller with a good blood vessel supply and allow the medications to do the job that they need to do, which is to try and suppress the tumour. We also get better metabolic regulation as well. So we have an increase in mitochondria within the tumour, and that means that you can use energy more efficiently in the tumour. Okay, and then of course there are other effects as well on the regulation of the tumour microenvironment, and all of it's there to try and enhance the effects of the cancer treatment and also to reduce the tumour size. So when we think about the most common treatments that are used for treating cancer, radiotherapy and chemotherapy are often the mainstay first-line treatments. So in about 60% of malignant tumour cases, you will have radiotherapy being used. And as I was saying in the previous slide, if the tumour is, because of the exercise, is small with a good blood vessel supply, it's going to respond very, very well to the radiotherapy, so the treatment's going to be more effective. If you have a large tumour, and because you're not doing any exercise, the tumour is just growing in size, it doesn't have a blood vessel supply, then essentially what's happening is you're going to have a very low response to the radiotherapy, which means that your cancer is likely to go on for longer, potentially metastasize, and that could impact on the survival. So exercise is extremely important for enhancing that tumour blood vessel circulation, and so when we think about chemotherapy, radiotherapy, it's the same approach, it's the same mechanisms at play. You've got a smaller tumour with that is better vascularized. The chemotherapy drugs can do what they need to do. In this slide here, the key thing really is that not many patients, after they receive their diagnosis, take part in any type of exercise. So only 8% of patients meet the recommended target of 150 minutes of aerobic exercise. That's moderate to vigorous. We have a lot of sedentary cancer patients as well. And of course, a lot of patients tend to get cancer when they get older, so they already have other comorbidities like type 2 diabetes, cardiovascular disease, hypertension. They have lower fitness and strength. So there's a lot of other implications as well. So essentially, when we get patients to exercise, we want to try and remove all of the barriers that might prevent them from exercising. So you want to make exercise as accessible as possible. So you've got an exercise patient that's been referred to you. What you would want to do is some pre-exercise, pre-assessment considerations. So some patients, particularly those individuals that have breast cancer, might present with lymphedema, and we can see the example here is somebody with quite an enlarged limb relative to the other in the upper and lower body, and of course that's going to have an impact on testing for exercise testing and also exercise prescription. So it's important that that patient has been medically cleared, perhaps been seen by a physiotherapist as well, that they are able to safely use those limbs, and if they are, then it's safe to use 1 repetition max testing, for example, to get their baseline strength level so that you can work out your exercise prescription. Some cancers metastasize into the bone, and when that happens, the bone mineral density is reduced quite significantly. There's an increased fracture risk. You've basically got very brittle bone, and any forces going through it will cause it to fracture, and that will obviously put the patient out of action for a long period of time. So you need to avoid that. So with bone metastasis, it's very important to make sure that you don't include exercises which unnecessarily load the bone, because that will essentially increase that risk of fracture. So you've got to just be aware of where the bone metastasis might be. Some individuals will present with nerve damage, and that can cause issues in terms of their proprioception and being able to judge their movement. They might have balance issues as well. They might be unstable. They might have gait abnormalities as well. So again, what you want to try and do is make sure that you're not doing anything which increases their risk of falling, and you want to assess the balance beforehand as well. What is their balance, and tailor the exercise prescription accordingly. Think about using stationary equipment like ergometers instead of moving equipment like treadmill. If patients have an ostomy bag, then you want to avoid increased intra-abdominal pressure, so you want to really get the patient to avoid doing the Valsalva maneuver where you can raise the intra-abdominal pressures. So it's just being mindful of that situation. So once the patient's medically cleared to exercise, then the key thing for you as a practitioner is to make sure that the exercise prescription is individualized. Okay, so you want to make sure that you've got your musculoskeletal issues sorted, if there's any peripheral neuropathy, that's sorted. You've got as many pre-comprehensive exercise tests as you can, medical health questionnaire, some screening, speak to the patient about what they want to get out of the exercise program as well. Some patients, for example, patients that have breast cancer, might be taking drugs like Herceptin, which can cause damage to the heart, and we call that cardiotoxicity, and that can lead to heart failure and can decrease exercise tolerance. So in that situation, you just need to be aware of the drugs that they might be on and liaise with the healthcare team about any appropriate situations for that patient, plans for that patient. If the patient does present with heart failure symptoms, it's important to refer them back to the oncologist. They most likely will have an echocardiogram, and that will be looked at in more detail. Okay, so in terms of the aerobic exercise, then extremely important, I've put it in capitals, it must be individualized to the person. You really want to start off at a very low intensity or low frequency to begin with. If somebody's never exercised before, they're older in age, you might need to consider intermittent exercise and maybe do it on just one day of the week to begin with. But as they start to become fitter, you can start increasing the frequency, and the recommendation really is 3 to 5 days per week. So that, you start off at the lower end, and as they progress through the weeks and the exercise becomes more tolerant, you start aiming for the 5 days per week. In terms of the intensity, you want to keep the intensity moderate. That's somewhere between 40 to 60% of the heart rate reserve. Okay, so heart rate reserve can be measured by taking the maximum heart rate, and that can be 220 minus age, and subtracting the resting heart rate of that individual, a truly resting heart rate, and you'll get a nice heart rate reserve. And you can set your exercise intensity somewhere there. You could use the ratings of perceived exertion scale, and 12 to 13 would correspond to a moderate intensity. If you've got patients who are younger or they are responding well to treatment, then you can consider vigorous exercise as well. So somewhere between 60 to 89% of heart rate reserve, RPE 14 to 17, can also be recommended. Time, begin with intermittent if you've got a deconditioned patient. Otherwise, you want to gradually work up to 150 minutes a week of moderate, or 75 minutes of vigorous, or a combination of the both. And you can do all types of activity, but keep those caveats in mind. If there's balance or instability issues, try and choose exercises which generally involve a lower risk of falling. Okay, so in terms of resistance training, then it's the same format that you're following really. Start off gradually, and then you ease the load as the patients start to get better. So 2 to 3 days per week. Try to do the resistance training on days they're not doing aerobic training. The intensity should be really low to begin with. So we're talking 30 to less than 30% of 1 repetition max. Anybody that's watched my videos on rheumatoid arthritis, multiple sclerosis, and some of the other clinical conditions will know that the general recommendation for those populations is somewhere between 60 to 80% of 1 repetition max. But in cancer patients, the recommendation is less than 30%, and then you have small increments each week. So if the patient is able to do a couple of reps more than what is the target range, and they're easily able to do a couple more reps, then you know that the following week you can increase the intensity, the weight, the resistance of the exercise. In terms of the time, one set, 8 to 12 repetitions, have plenty of rest in between the sets as well, or between the different exercises, and try and include a number of different exercises that target the upper and lower body. Include free weights, resistance machines, body weight exercises, and some functional exercises that help with activities of daily living, and flexibility should be included, as you would do for any other population as well, and that's the most important thing. But resistance exercise should also be individualized for the patient. Okay, so some exercise prescription considerations. So it's very important that exercise might make some of the cancer symptoms worse. So you've got to be monitoring the patient regularly. The whole purpose is to supervise the patient. If they're doing home-based exercise later on in the program, consider asking them to keep a training diary or log and write down what they feel and experience, and they can discuss that when they meet with you the next time, and you can just have a look to see if there's anything that the exercise might be aggravating. So the mantra, start low and progress slow, extremely important for cancer patients. So really you don't want them getting to do too much too soon. There will be a lot of other things going on in terms of the treatment. Some people might have surgery as well. Some people might be starting new regimens, switching. There'll be lots of things going on along with the emotional stress as well. So it's important to start low, progress slow, so that they have the motivation to keep going for the long term. So I mentioned heart rate reserve in the previous slide, particularly for the aerobic exercise. So for some patients, it's not always accurate for monitoring the intensity, especially when they start treatment early on, or they might be, it might even be post-treatment as well. There might be some differences in the way that their heart is actually working. So in that situation, it's better to use the RPE or use the heart rate max and set the intensity as a percentage from that. Lymphedema can be a problem in exercise sessions as well. So the general advice is to advise patients to wear compression garments, which will help to reduce some of the swelling as well. And a sports bra for females might be important as well when they're exercising, to try and limit some of the effects. And again, the key thing is not to have too heavy weight and avoid wearing tight jewelry during the exercise session. We mentioned intermittent exercise, so I'll keep it brief. Might be more practical during treatment when the patient's got long treatment regimens and it's not so easy to do long exercise bouts. Intermittent exercise might be very useful in that situation. So really, in clinical practice, what you really want to do is make sure you are aware of the most recent exercise recommendations for the specific type of cancer that you're dealing with. And you can look on PubMed, you can look on Google Scholar and find the right academic scientific articles. You can also look at the American College of Sports Medicine's guidelines for exercise testing and prescription, either the 10th or 11th edition. Table 10.2 and 10.3 on those respective pages have a very good overview of what you would do in terms of management of cancer symptoms, in terms of the exercise prescription. Don't be afraid to seek advice from your experienced colleagues and the healthcare team as well. That is going to be invaluable in your quest to have the right knowledge and information for the patient. So in summary, cancer patients are advised to be physically active, and it's very important to try and counteract the low levels of physical activity following a diagnosis. But we do have to give careful consideration for the type of cancer, the type of treatment, and any specific symptoms that are related to that cancer. Therefore, always make sure the exercise prescription is individualized to that patient. So I hope that this has been a useful video for you. Please do keep an eye out for more videos coming soon. I'll hopefully see you then.